Hello, welcome to our third episode of Friends of the Forest, Will and Forest podcast, where we learn about our community and how they help to make Tuscaloosa a great place to live. I am Timothy. Today I had the chance to interview someone special about their work as a nurse practitioner. I am here today with Dr. Betts, and I am going to ask her some questions so that I can learn more about her life and career. We hear you went to Tuscaloosa City Schools as a student. What school did you go to?
I did. So I went here at the Woodland Forest Elementary School, and then I attended Eastwood Middle School and graduated from Paul W. Bryant High School in 2008.
Interesting. What was your favorite subject when you were a student at Woodland Forest, and did it help you become a nurse?
So my favorite subject was math, and it did help me become a nurse because in nursing school, you have to take this class called pharmacology. And what pharmacology is, it's how you kind of calculate the dosage for a patient when you're going to give them their medication. So you really have to have some good math skills in order to pass that class.
Do you remember any of your teachers?
I do. The one that stands out the most was my second grade teacher. At the time, her name was Miss Dent, but now she goes by Miss Shalandra Martin. And I do run into her often here in town in the community.
That's amazing.
Thank you.
What do you think she would say about you being a nurse practitioner?
Well, I think that she would say that she's very proud of me, especially the person that I've become personally and in my career, in my profession.
What is the difference between a doctor and a nurse practitioner?
So the difference between a doctor and a nurse practitioner is that a doctor has to go to school for a very long time in order to learn just about any and everything when it comes to the human body, different diseases, illnesses, and how to treat those things. As far as a nurse practitioner, we go to school for about 4 years to get our nursing degree, and then we go back to school to get further education so that we can learn how to do some of the same things that a doctor does. But essentially, when you put both of those together, we are both in the field of helping people. We just took different school paths to get there.
Do you have different superpowers?
So I would say my superpower is I try to get to know my patients on a more personal level. That way they can feel comfortable with me. And then I also let them know that I am taking care of you the way that I would want one of my, I'm taking care of you the way that I would want my loved one to be taken care of. So I really try to make that connection with them.
What are some of the tools you use every day, and which one is the most fun to use?
So the tool that I have to use every day would be this stethoscope right here. If I do not take this to work with me, then I cannot do my job. But what a stethoscope is that it allows me to listen to your heart even clearer, and I can also listen to your lung sounds, and then also your abdomen. I can listen to those bowel sounds. So if you're rumbling, I can hear that really good. But it allows me to pick up on if there are any kind of differences from what the normal sounds may need to be. So this is definitely my tool that I use every single day and couldn't get my job done without it.
Do you have to wear special uniforms or scrubs every day?
So I work in a clinic where we can wear business casual, similar to what you have on here today, or I can wear scrubs like I have on today. My favorite is wearing scrubs because scrubs, I kind of can personalize them how I want to based off of my personality. I love wearing bright colors. I can accessorize them with different color sneakers like I have on today. I can wear scrub caps that kind of match my scrubs for the day, or even some headbands. So my personal favorite are scrubs.
Why are they better than wearing regular clothes?
Because for me, they're more comfortable. And then I don't have to take a lot of time in the mornings with kind of putting the outfit together if I decided to wear business casual.
That makes sense. What is the best part of your day?
So the best part of my day is knowing that I made a difference in someone's health. When people come into our clinic, they're sick and not feeling well. And so for me to take the time to think about a plan for them and give them medications that'll help treat them and make them feel better, that makes my day.
Sometimes kids are a little nervous when they go to the clinic. How do you help them feel brave?
So I go in by talking with them and trying to get to know them. I ask them like what their favorite color is. If they have a favorite subject in school, I ask them about school. I also let them know that I have a baby myself and he's 5 years old, because sometimes that'll make a little kid, less nervous. But I try to interact with them on different levels. I show them some of the tools that I'll be using to help them feel better. As far as like my stethoscope, I let them play with my stethoscope if they want to. Sometimes they'll put it on themselves to listen to their heart. And then we also use this thing in clinic called an otoscope, which I look in their ears and it has a light at the end of it. So I'll give it to some of the kids sometimes too and let them see that the light is flashing on their hand, on their face, and they'll also put it in their ear. That way they can have an idea of what it'll feel like when I put it in their ear to look and see what their ear looks like. So I do different things like that just to kind of make them calm and feel good when they're with me. But if they do tell me they don't want me to do anything, then I just stop there because I don't want to make them upset.
I remember, like when I was 1 year old and my brother was 3. So like we had went to the doctors to get our flu shot. I had went first, I think, and they had gave me my flu shot, and I didn't cry. But when my brother took it, he started crying. And after that, the next 2 years when we got our flu shot, the same thing happened.
Really?
And he's older than me.
Oh, I know when my baby got his shot last year, he cried as well. And he told me that he didn't want that nurse to touch him anymore. But we talked about it. And so the next time that he had to go to the doctor, he felt a little more better. He felt better when he had to go back and see that same nurse. But he did let her know that he didn't forget that she gave him that shot that made him cry. So I understand that.
What was the hardest thing you had to learn in college to get your big degree?
So the hardest thing I had to learn in college was time management. I thought that when I went off to college, I could do just about anything. I could hang out with my friends. I could go to the college parties on top of going to class, studying, and passing my tests. But I soon realized that you can't do all of that and still get to where you want to be in school. I tell anybody that my story is that I did not pass the first semester of nursing school, which I had to sit out for a full year because I thought that I could do it all. And I quickly realized once I had to sit out that when I got back into the nursing program, my main focus was strictly going to be school because I was there for a purpose and I wanted to get my nursing degree. So when I got back in, I put everything else aside and I was there and I was in my books each and every day until I graduated from nursing school.
And sometimes it's actually hard for like me to study. But every time it's hard for like me to study, so like I block all of that out of my head and put my brain to work.
Absolutely, got to put that thinking cap on. You are absolutely correct.
If a student at the school wants to grow up and help people just like you do, what is one piece of advice you would give them?
I would tell them that you can do anything that you put your mind to. That was one thing my grandmother always told us growing up. Never have the word can't in your vocabulary. And just know if you put your mind to it, you can do it. So that's absolutely what I would tell them.
It is amazing to see how far a journey can go when it starts right here at our school. We've learned that being a nurse practitioner takes a lot of work and a big heart, but it all began with the same lessons we are learning today. Thank you so much for coming back to visit us and for showing us that no matter where we go in life, we have a great place to start. Thank you so much for spending your time, and we wish you a happy Nurses Appreciation Week.
You're so welcome. Thank you so much for interviewing me.
You're welcome.